Now we're going to discuss the 4-point MSR dorsiflexion protocol. We're starting out with the tibialis anterior. We're going to use a forearm treatment contact. So we're going to create some tension, posterior, superior, and lateral, and we're bringing that ankle into plantar flexion. And make sure we hold the end ranges. Just nice and slow movements, maintaining tension. Doing okay there, Mickey?
Oh yeah.
Yeah. Good. So once you've done, anywhere between 3 and 5 passes along the tibialis anterior, you're going to move slightly lateral, and we're going to get onto the extensor digitorum longus. And you can see I'm shifting my hand contact here on the foot. I'm actually going to hold digits 2 through 5. And now once again we're creating some tension there. Good. Doing okay?
Yeah.
Pronate the forearm to increase your tension. Flex the toes. There we go. Good. Go way down a bit more. Good. Now, we're going to go between the two structures a little more distally, and right in here we're going to go slightly deeper, and we're going to get into the extensor hallucis longus. So I'm shifting this contact hand to the big toe, and I'm going to assist by pulling it into flexion there. This one's going to be pretty intense.
That's actually pretty nice.
Okay, nice. That's good. Good. Just right in between those two structures, slightly deeper. Good. There we go. So once you've worked your way through those 3 structures, then you can actually have the patient slightly shift in their position, and we're actually going to get on the peroneal muscles. So same forearm contact, but this time, as we create our tension and I pronate my forearm, I'm actually going to pull the foot into supination. Good. Now, anatomically, the peroneals, especially Peroneus longus, is quite important because the tendon goes down behind the lateral malleolus across the cuboid into the foot here towards the first metatarsal. And then on the medial aspect of the shin, we have the tibialis posterior running down behind the medial malleolus. And as the 2 tendons converge, they actually help to form and support the medial arch of the foot. Earlier when we were on the tibialis anterior, fascially that's extremely important because it ties into the fibular head here, but so does the IT band as it comes down. So very important structures fascially. So back to the peroneals here. We're just going to bring the foot to a little bit more supination. Oh yeah, you can feel these ones here. Doing okay?
Yeah.
Good. So you want to work your way all the way down. Yeah, there's a good spot there too. Good. Now, something very unique and key to MSR is that we're going to introduce some torsion. So we're going back to the tibialis anterior, and we're going to create the same idea in terms of tension as I pronate my forearm here. As we pull that foot down though, we're going to start to incorporate some rotation. And as you do this, you might want to play around with, whether you're going internal or external, but you can really start to feel the fibers move underneath your treatment contact and they start to separate. Doing okay?
Yeah.
And maintain your tension throughout. That is key. Good. So now as I move laterally onto that extensor the extensor digitorum longus, I'm going to grip those toes again. There we go. Good. And you want to make sure you're creating tension across the muscle fibers as you do this. That is key. Yeah, right there.
Yeah.
Okay. And then moving a little more in between the two and slightly deeper here, we're going to get onto that extensor hallucis longus and really use that big toe to help increase tension as we create torsion as well. Doing okay?
Yeah.
Yeah. Don't forget to check in with your patient. Good. Now we're going to have you just slowly turn the leg slightly. Same concept now with the peroneal muscles. So we're going across And now we're really going to bring that foot into supination and create some torsion. Yeah, I can really feel a good pocket right here of restriction. And you can just, try to really visualize in your mind's eye as you feel those fibers, moving underneath your treatment contact. You can literally feel the change as you go through the protocol, as things really start to loosen up and release. Okay?
Yeah.
Yeah, see there, it's already starting to move better.
Feel a lot better.
Good. So just really great, effective protocol.